Hello, hello, beautiful people, and thank you for being here once more. Today is Sunday. We are going to have a wonderful guest with us. Her name is Dr. Catherine Carley. She is a psychiatrist, and with her, we are going to talk about mental health, mental fitness in times of pandemic, and resilience. Thank you for all of your great questions in the story with the question box. Per usual, well, not mixed, but I grouped them by categories. So tonight we're going to talk about obviously mental health. We are going to talk about resilience, and we are going to talk about the good doctor herself, as many of you are very interested in how she got into psychiatry and what her specialty is and what she thinks someone who wants to enter that field should have as strength, and what type of effort it takes to become a psychiatrist. So she's here right now. We are going to go live with her. If these things work. Okay. So here. Hello, Dr. Carley. It's just, well, between Europe and the US, it might take a little bit of time. And here we are. Hello. Hi.
Hello.
Hi, Doctor. How are you? I'm good. Thank you. I woke up a little bit like under the weather, but this afternoon it's, a lot of traveling, autoimmune disease, all of that. But
yes.
it will be good. I have a wonderful herbal tea, a wonderful audience, and you here, so it's going to be perfect. First off, I want to say thank you for being here. I know that you are very busy women. You have 4 children, and
thank you.
Today is Sunday, so really thank you for making the time to be here with us. As I was saying,
we have, of course, thank you so much for having me.
Oh, well, thank you so much for saying yes right away when I asked you. I really, really love all that you're saying on your Instagram account, and also how you are really kind of saying that in life, whatever you do, you have to just hang in there, believe in yourself, believe in your purpose, believe in your mission, really. And go for it, whatever other people might say, whatever obstacle you have to go through. That's why I thought that talking about resilience was that you were definitely the person for the job. So thank you for saying yes.
Thank you, no problem.
So we don't have a lot of time. We're going to get right into it. Plus, like I said, you have 4 children at home. So can you first tell us a little bit about yourself, Dr. Carley, and congrats as you got your diploma just a few weeks ago. So congratulations for that. Can you tell us a little bit more about yourself? We have a lot of questions. In fact, we have 3 types of questions. One is about really mental health, so to have a clear definition of what mental health is. The second one is also, well, the other kind of questions we have are about resilience. And also we will start with what resilience is and what it means and how to get it. So we have a lot of questions about how do you get resilient? What is it exactly? And the third type of questions we have are about you. So who are you? How did you become a psychiatrist? Did you always know that that's what you were going to be when you grow up? These types of things. And I asked you also to join today, as I said, because, well, you definitely had to be very resilient in your life. So let's talk about that.
Yeah, of course. So my name is Catherine Carley, and I did just receive my medical doctorate, so that is awesome. I wanted to be a physician since I was 7 years old. Growing up, I definitely had some challenges. My mother suffered with addiction, and so she was kind of in and out of my life, had some homelessness. I ended up growing up with my great aunt and my great grandmother, who are just phenomenal women, and my mom is a phenomenal woman. I think when I really realized all of her struggles with
Mm,
depression and how
mm,
her struggles with depression led to addiction, I was fully able to understand her, to forgive her for, not necessarily being there in my childhood. And it was just the most freeing moment
yeah.
that I feel like I'd had in my life when I fully understood the dynamic between mental health, untreated mental health, and how it affects everything in your life. It affected her being able to work, it affected her parenting, it affected everything. And so that is the point. So when I wanted to become a doctor, it was not because I wanted to become a psychiatrist. I really wasn't familiar with mental health at that age. It was just because I grew up on Medicaid, which is a public funded insurance here, and I kind of felt like we were pushed aside. There were very few doctors who did not accept Medicaid, and we would have to call all around to find someone just to see us. And so I just felt like, people don't deserve that because they don't have enough money to pay for health insurance. And so for me, becoming a physician was really about fairness and giving to those who are most in need. I didn't necessarily know what type of doctor that I wanted to be, but when I started that psychiatry rotation and I saw how untreated mental health affects every aspect of your life, your work, your financial life, your social life, your, like I said, parenting, family endeavors, that is when I knew that this was what I wanted to do for the rest of my life. And just like me having those moments on the psych unit that helped me to understand my mom more, made me want to also educate other people on mental health concerns so that people could understand that may have these issues, and everyone be able to.
Hello, hello. What's happening?
Hello.
What's going? Yeah. Are you still here? So, and
Yeah.
yeah, so when you went on your psychiatry rotation, that's when you really realized that mental fitness was important for every aspect of one's life. That's where,
Yes.
okay, okay. I don't know if you hear me. Do you hear me? Because here is buffering. God, this thing when it works is wonderful, but when it doesn't, it's infuriating. Ah, okay. I think it's working for now. Oh, so let's, you said something. I'm sorry. Ooh, okay. So that's being live, people, right? That's what happens when you're live. So now we are going to start again. Try this thing once again. Dr. Carly, are you here?
Okay.
Yes, you're
Yes.
here. You're
Okay.
back. Great,
All right.
great,
Were you guys
great.
able to hear me?
Yes, yes,
Okay.
now it's
All right.
perfect. So if you don't mind, if you can
Yes.
go back just a little bit about what you were
Yes.
saying about your rotation in psychiatry, that's when you realized how much, let's say, unfit mental health. I don't know how to
Yes.
say that, but not to be,
Right.
pejorative here. But when the mental health issues are left untreated, it affects everything in one's life. So that's what you
Right.
were saying last.
Right. Yeah. I mean, not only in my psychiatry rotation, but every rotation that was the case. I mean, even in surgery, if there were people who needed, psychiatric treatment and they hadn't received that, then the surgeons were like, okay, well, we need to make sure they get their treatment so that after they have this surgery, they can keep up with all the things that they have to do. And so, for me specifically, psychiatry was my first rotation. And my grandmother had schizophrenia, and it was kind of like a thing that we talked about, but I never really understood what it was. And when I understood what this thought disorder was and how pervasive it was, and how, she was hearing voices, the times where people would say, oh, your grandma's she's just different, but like when I
Yeah.
really understood the trauma that she was going through every day, like hearing these voices and having a different like a whole different mindset on what was going on around her than the rest of us. Like my heart really went out to her, and my heart really went out to my mom as well, who suffered from depression secondary to my grandmother's untreated schizophrenia, because it was just one of those things that was like, we it was taboo. You don't want to talk
Yeah.
about having mental health concerns, especially for me coming from a Black Christian community. It's a lot of it, we talk about demons, we talk about praying about it, but the reality is that, like, my
Yeah,
grandmother
you
needed
pray on it. You
medication.
pray on it.
Yeah, she needed medications, and of course prayer is great, and like my faith has helped me through a lot. But the issue is that a lot of people do not see these psych diagnoses as things that can be treated. But when I did this psych rotation and I saw people who had been treated come out of these most severe depression, or tell me the voices have gone away, or the voices are still there, but I can tolerate them now in order to go back to work. I can tolerate them to, deal with my family. It changed my life. I felt was freeing, would have freed my family, that I wanted to be a part of freeing others that in that way.
So for you, in your family and the way you were impacted by mental unfitness, in fact, it was generational. It started with your
Right.
grandmother, then it affected your mother, and you're the one who broke the cycle in a way.
Thank you. Thank you so
Oh, no,
much.
that's great. Well, thank yourself, girl. Girl, sorry, doctor. I'm so into this conversation. I'm okay. So it's Mental Health Awareness Month in the US right now. It's also Mental Health Awareness Week in the UK. One of the questions I had, so we had a lot of questions in the story with the question box. And one of the questions that comes a lot is, in fact, what really is mental health, and how do I know that I am not crazy in a way? So a lot of questions are really, what is mental fitness? How do I know that maybe not something as brutal, I would say, than hearing voices, but there are really things about what is it to be normal. So how do I know I'm mentally fit?
Yeah, normal. Okay, yeah, normal is one of those, like, terms that I think psychiatrists don't necessarily like to use a lot, or I have not heard a lot of psychiatrists use, because sometimes, if people do suffer with, like, schizophrenia, for example, they hear voices, and the most we can do is kind of like numb those voices or help them to tolerate their voices. We don't want them to think that that there is like something so wrong with them, and so we try not to use words like normal or crazy, because those things kind of perpetuate the stigma a little bit more than it already is. But overall, mental health is our emotional well-being. It's our psychological well-being, our social well-being. So that's like pretty much everything that we consider mental health: how we think, how we feel. And when we talk about mental, it's a spectrum. So we all have mental health, and we all need to do things to, work on our mental health, whether that's stress relieving with yoga and journaling and diet and exercise, or talking about our feelings with our loved ones who may have hurt us, that's sad, to go on to the spectrum of those who have mental health concerns that may lead to a psychiatric diagnosis. So those people who with something in their family for so long, to where it have depression. Are you here? Is it still breaking up? Okay.
Yeah, no,
So
no,
then we
it's
go.
cool. It's cool. You're here.
Yeah. Okay. All right. So it's a spectrum, to where on the other end of it, there is your depression, generalized anxiety disorder, and your panic attack, schizophrenia. And so we want to acknowledge that it's a spectrum, because just because you have those diagnoses doesn't mean that you don't need to take care of your mental health in the same way that everyone else does. It means that there may be additional things that you need to do, like take medication or go to additional, or a lot of the other treatments that we have that other people may not necessarily be adamant about, like there are a lot of treatments out there for people who are having and experiencing those symptoms. I know you want more maybe about the symptoms that people may be experiencing as well.
Yes, 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 yes. So we have a lot of questions also. So thank you for that. Thank you for
Okay.
saying that there is no such things as being normal or abnormal. There's a spectrum, and we all have to take care of our mental health the same way we take care of our physical health, right? But perhaps we live in a society where we talk more about physical health, definitely. And we have more, let's say, type of thresholds or type of markers to tell someone, well, you're healthy or unhealthy physically.
Right.
But when it comes to mental health, as you said, because it's a little bit more taboo, and there's this whole thing about, and not only in Christianity, in a lot of religions, right? And in a lot of cultures, it's about demons, good and bad, being possessed, being this and that. So mental health, I would say that in a way, it's also quite new in the land of medicine, and of looking at it in a way that is not dispassionate. So it's not about without passion, but more from a clinical point of view. So thank you for making that clear. And yes, we do have a lot of questions about dealing with depression, anxiety in these very complicated and particular times. And also, so what should one be on the lookout when it comes to depression and anxiety at the moment, as in the US, but all over the world? We had a lot of instructions of sheltering in place. So people are inside and not going out. They can be very far away from their family. Some people can't really deal with the fact of being isolated, having to stay at home. Personally, I love it. I'm great. I do my yoga and that meditation. But we know that for other people, it can be quite difficult. And for some people, they even start to feeling depressed. So I have a lot of questions about how do I know that what I'm feeling right now also, again, comes from it's normal, and how do I deal with that, feeling depressed and not wanting to get out of bed because I have nowhere to go in a way.
Right. So, I can speak from this from a clinical perspective and also from a personal perspective, because I suffered with postpartum depression after I had Chloe. And to be honest, I had no idea what was going on. I tried to sit down and study, and I couldn't concentrate. I couldn't focus. I had these constant thoughts of like maybe I would die, or like it wasn't that I wanted to commit suicide, but it was just like I would always think that some type of way I would die. I wasn't interested in the things I usually like to do. I slept a lot. I didn't have any energy. And I felt guilty, like so guilty about all of that. And because psychiatry initially on my radar at the time, I hadn't really studied psychiatry a lot, right? I was studying for boards, and it was like, I'll study psych last because, like, it's the shortest thing, it's the shortest number of pages in my book. So I was like, okay, well, I'll study those pages last. And then when I got there to those pages, I was like, oh my God, this is me. Like, this is me, because there's a mnemonic.
Like textbook you.
Right, exactly. There's a mnemonic that we have for depression. It's called SIG-E-CAPS. So it is sleep changes. You can sleep more or you can sleep less. It's the I is for interest. So you have decreased interest in things you normally like to do. The G is for guilt. The E is for energy. So you can have increased energy, decreased energy. Mostly it's decreased, but there are some atypical forms of depression that can cause increased energy. Then there's C for concentration. A for appetite. So appetite, just eating more, eating less. The P is for what we call psychomotor slowing or psychomotor retardation, which is kind of like you feel like you're thinking slow, moving slow, kind of like your brain is in a fog, is what I think the colloquial expression is here, like a brain fog. And then the other S is
Mm-hmm.
for suicidal thoughts or suicidal ideations or constant thoughts of death. So if you have any 5 or greater than 2 weeks, then that is clinically considered depressive disorder. And so that is what that is. And so what we normally do as psychiatrists normally do, and me as a medical student, what I helped the psychiatrists do was to treat the depression with drugs that we call SSRIs. And these drugs increase the amount of serotonin in the body. Decreased serotonin is known to negatively affect your mood. So these medications are not medications that people would have to be on for long periods of time. They want a person to be treated for them, be fully treated for their depressive episode, come out of the depressive episode prior to coming off of the medications. Same with anxiety. The medications are the same, just different doses for
Dosage.
anxiety. And so with anxiety, it's like, or the generalized anxiety disorder, you kind of are constantly worrying about different things, different activities, different, um, and you're doing this most days. Like you're just constantly worrying about things that haven't happened yet, things that may happen. Did I leave the stove on? Did I do this? It's like your brain is constantly filled with worries. And then on top of that, you can also have symptoms with it. So a lot of people that have anxiety also have restlessness, fatigue, a hard time concentrating, irritability, because like, in certain situations, the uncertainty unsettles them. And so that is also treated with serotonin reuptake inhibitors, selective serotonin reuptake inhibitors, just different doses. So on a personal level, though, on an individual level, the things that you can do while seeing a psychiatrist or a family doctor, both can treat these, or internal medicine doctors can treat these as well, are to focus on your overall mental health. So there is now also something called the inflammation theory, just to say that like the stress that we go through it, for COVID, for example, all of the stress that we're going through with COVID, just from being home, it's definitely been difficult for me. um, Puts a stress on your body that causes your
Mm.
immune system to undergo this inflammatory response. So that means these cells in our body that are meant to fight off diseases are ramping up, and they're so ramping up in our brains. So this can cause symptoms of depression or anxiety. And so what we can do on a personal level is, yoga really helps to decrease
Oh,
inflammation in
yeah.
the body. Drinking water really helps to decrease inflammation in the body, and eating an anti-inflammatory diet, which is like what I'm doing right now. So
Ah, good for
basically a
you.
diet that, thank you. It's basically a diet that does not have like any alcohol, any fried foods, any refined.
Ah, it's breaking up again. I think you said no
Okay.
alcohol, no fried food, and no refined sugar. I think you were going to say yes.
Right. Yes.
Yeah,
No
okay.
alcohol, refined food, sugars, soda, all of. So right now, I think is a time for, if people have access to being able to get fresh and healthy foods and
Ah, you're breaking up
eat.
again. So
Oh,
you
sorry.
just said if people can have access to fresh and healthy foods,
Right.
they should
Having
do that.
that access to, they should definitely do that. And I definitely encourage you talking to your a therapist. And now I know a lot of doctors cannot go into the doctor, but you can still make the telemedicine appointments. And it therapy, a family doctor if you need medications, and a therapist can definitely tell you like if you need to go further and see a psychiatrist or a doctor to give you medications if they cannot give you medications. And so it doesn't matter. I think a lot of times we kind of think this situation caused my depression, because that's kind of what I thought initially. I was like, a
Yeah.
lot of the issues that I had in med school I know caused my depression. And so you think when you're out of that state that it will go away, but some of it is it's multifactorial. Like some of it is situational, but some of it is actually like how your body has changed to try to deal with that situation. And so regardless to what happened to cause it, we still need to go to the process of taking medications, eating healthy, going through therapy, and realizing that it can be a part of us, so that if something happens, like for me, when this pandemic happened, I was like, okay, I know that I need to be serious about exercising, eating right, because I know that I am prone to depression. Like this is something that I know that going into a stressful situation, I need to go ahead and prepare myself to prevent myself from going down that path again. And so it's not just like it starts and it stops. It's one of those things that you have to constantly be aware of. And if you kind of claim it as a part of who you are, then it allows you to take control over it instead of it taking
instead of it taking control over you. Absolutely, absolutely. Everything that you said. So we have Dr. Joe, PhD here, who says, "Oh no, I can't eat anything." Well, girl, like eating healthy, not eating fried foods, because no one really got over anything serious by eating fries and burgers, right? But you can make it fun. You make it fun. You make some smoothies, you make some veggie lasagna. And for the alcohol, perhaps you can have like a cocktail afternoon once a week. It's good also for your mental wellness, also mental fitness. But I guess what Dr. Carly here is talking about is just, staying home all day and nursing that red wine bottle. That's not going to help with depression and anxiety. So we had questions about what is the link, or is there a link between food and mental fitness? So what you're saying is that there is. In fact, it's inflammation, and what you want to do is reduce inflammation in your body. And I absolutely hear that, dealing myself with an autoimmune disease. That's exactly the type of diet I have. I wake up every morning, I do yoga, meditation, and I'm also on intermittent fasting diet. So I wait until my time to eat. I have that breakfast, more like a brunch situation that is happening. But yeah, definitely yoga and meditation twice a day. A lot of smoothie. And on the weekends, a little bit of rum in my smoothie, or I make a cocktail. So Dr. Joe, maybe you can do that too. Yes, you will be creative. I have no doubt that you will be creative. So yeah, you say that dealing with depression is not, it doesn't have to be a problem. You just have to embrace it. You have to be aware of your own situation, and then you have to prepare for that. It's all about preparation, right?
Right, exactly. And I say this because 16 million Americans will be diagnosed with clinical depression a year, right? At least one episode of clinical depression. And then it is also mood disorders like depression and anxiety are the third most common cause of hospitalizations in the United States. And so when we kind of put it in a spectrum, like it's something that starts and stops, then it kind of like lets people think like, I'm going to take this medicine and I'll be done with it and it'll be over. But I think one of the most powerful things that I have heard on this journey was, and it was kind of shocking to me, but I heard a doctor tell a patient, like, that your suicidality is a part of you, so you have to put yourself in situations to where it doesn't come out. And I think people that are struggling with mental health concerns think that it's something that they just have to get rid of, and it just needs to go away. but it is something that a lot of people are coexisting with. The first time I talked to a patient that told me like, oh no, I still hear the voices, I have just learned to deal with them. That was very powerful. The goal, yeah, there are times where we can eliminate everything, but there are times where we can't. So it is the best option to realize that even if it's a part of them, it doesn't mean that they're not normal, it doesn't mean anything, but there are things that in terms of medications, diet, exercise, therapy, to become the best version of your personal self. So the biggest thing I think with mental health is to never compare yourself or your journey to someone else's. Two people with schizophrenia are not the same. You know, people say all the time, like, people with schizophrenia can't hold a job. But, you know, I have a family member that's schizoaffective that works a very good job. She makes good money, you know, so it just, everyone is not the same. Everyone's situation, and we have to see everyone different. Everybody has to exist in their kind of own spectrum of their mental, of taking control of their mental health.
I love what you're saying, and I think it's really, really empowering. And as Dr. Diona also is saying, she loves the reframe. And you have to, well, it's part of who you are, whatever type of illness or situation you are dealing with. And now it's about you doing what is best for you, taking that factor into consideration. So you have to factor in the fact that, yes, you are dealing with anxiety. Yes, you are dealing with clinical depression. Like I had at some point have to say, okay, yes, I have this autoimmune disease. It is part of my life. I'm not going to treat it as an enemy. I'm just going to treat it as something that I have to deal with every day and take the necessary steps to when it comes to your diet, when it comes to calming yourself, but also when it comes to your meds. So maybe you will have to take meds, as you said, but the idea is then to phase out of them. And that's afterwards, it's about having the right lifestyle for who you really are and being on your own path, on your own journey, and not comparing yourself to other people and not being in competition with anyone else. You are on your own path. Other people, you're not even like in the same dimension as they are. So just you do you. Okay,
Yes.
I love that. I love that.
Yes. And
Yeah,
and
go
so
ahead.
important to just, oh,
We
because from the time that the average person starts to have symptoms, mental health concerns or psych diagnosis, to the time that they seek treatment is normally 11 years.
Wow.
And you, and
11
that
years.
is very
Wow.
11 years. And that's very concerning because, especially with, um, we see now with schizophrenia, that schizophrenia, every time a person has a schizophrenic break, their brain physically changes. And
Mm.
so, from the time that if a person has one schizophrenic break, and then we are able to treat them with medications, we have injections, we have lots of things, and they don't go have another break again, then their brain is like going steady. We look at the images, they're the same. But for people who don't have treatment or who come off of treatment and come back on, that every time they have a break, and when we look at their neuroimaging, the brain changes. And
Change.
so it's very disheartening for me to know that people are not see, able to get treatment for 11 years. And a lot of it is to dealing with the stigma. A lot of it is the fact that we know what signs or symptoms our family members may even have, you know, with mental health concerns. And a lot of it's just the fact that sometimes there are no signs.
Mm,
You
mm,
know, there
mm.
are the people who struggle with depression and they still get up and go to work every day and they try to smile and laugh. And, you know, maybe there are those subtle things like, you know, they don't show up to certain events, but maybe those things don't even come about. And so I think the best thing is to really work on breaking down this stigma and everyone being honest and open and allowing people to be open with them about anything that we think may be different, whether it's hearing voices or seeing visions or being really sad or having thoughts of death or anything, we have to be allow people to be transparent with us about those things so that they can feel comfortable going to see someone about those things. I think when the goal of it is to hide it, then we will never uncover and we will never treat the underlying problems.
So holding space and
And to me,
being
it
a
seems,
safe
yes,
person to talk to. Oh, you're
just
breaking
being a
up
safe
again.
person,
Yeah.
exactly, being a trustworthy and patients that hear voices, whether it's there are forms of depression, have psychosis, so there are people that get so depressed that they can hear voices, and there are also people with schizophrenia that can hear voices, and there are also people with bipolar disorder that can hear voices. We call them auditory hallucinations. We can't hear them, but they can. And patients, and I've seen them looking distracted, like they are hearing something that I can't hear. And I will say, "Are you saying?" And they will say no.
Mm.
And then if I say, I talk to a lot of people that hear voices, and these are the sorts of things that the voices tell them. And then they're like, "Oh wow, I'm not alone." And then they start telling me, "Well, this is what my voices are saying. They're saying this and then they open up." So just being able to have that diet in a non-judgmental way, I think really would allow a lot of people to progress a lot and to talk about their mental health with their families, and thus being able to seek out the providers. A lot of times, people do share with their families first, and then their families may tell them like, "Oh, that's not," because mental health is such a topic that we don't know.
Ah, you're breaking up again. You said just because mental health is such a topic that we don't know about. I guess you were going to
Hello.
say. Yes, hi. Are you still here? Are you still with us?
Okay, I can hear
God,
you
this
now.
is
Yes.
frustrating because what you're saying is so interesting. So basically, what you're saying is that we need to hold space for people to be able to talk safely about what is going on with them emotionally, mentally. Are they hearing or not voices? Are they feeling depressed? Are they feeling very guilty about something? Is there some change of pattern in the way they are eating, in the way they are sleeping, in their interests, and all of that? The way we help people get the treatment they need, get the help they need, is by holding space, is by being a safe person for them. Because otherwise, what we know, what you've seen, is that the average number of years someone waits before going to a professional is 11 years, and that is plain unacceptable, people, because when you have some crisis, for example, where, like you said, when you are I'm sorry. I'm just spacing out. It's the fever.
It's okay.
When you have
Oh no, I hope you feel better.
yeah, me too. When you have schizophrenia and you have a crisis, it changes, it rewires your brain, and not for the best, I suppose. So it is really important for people to be able to seek treatment
No.
early on, and to be able to do that, we need, as a society, as communities, to be able to hold space for someone. And maybe it's not you, maybe this scares you, but maybe you can be the person who gets the word out, saying to other people, people with mental health issues, that's what they need. I can't do it for any type of reason, but I'm telling you about that, and maybe you can talk to two other people, and maybe all together we can have a solution. Are you hiding out in your closet from your kids at this moment?
Yes. Yes.
Okay, can we get a little bit of light in this closet, Dr. Carly? Ah, good. Very good.
Hide in the closet.
Okay.
Is it
Yeah,
better?
much better, much better. So now let's
Okay.
talk a little
Is
bit
that better?
about, it's much better, thank you. Now can we talk a little bit about resilience? So like for mental health, can you tell us what resilience really is about? Because a lot of people are saying, but is resilient, being resilient and pushing through the same thing? What is it about resilience that is so good?
Okay.
So that
So
did
let
not
me
work,
step out
right?
one
The
more
closet
time.
did not work.
No, and I don't think out here it's going to work either. So, resilience essentially is never giving up. I think that is the most simple definition of resilience, but the action of it can be very difficult at times. I think a lot of it is a mindset that you have to decide that you want and that you're going to attain. Um, for me, going into medicine, a lot of people told me that I would I wouldn't make it. I wasn't able to do it. I should do something else, especially because I was a single mom. And, I came from a background where a lot of people, my family members didn't have a lot of money. And so, I was always told that I wasn't going to be able to do it. But I just always thought the rain is too loud. I'm sorry.
No, no, it's okay.
Um, I can't figure out where to go because it's raining outside. It's too dark.
Now here is
And
perfect.
so,
If you can do
okay,
it
all right,
here,
here's
it's
good.
fine.
Okay, sorry. And so, I always, just had to believe in myself. And I think that the first thing that starts with that is a learning self-love. Learning
Mm,
self-love is so important because when you start to learn self-love, you realize what is it that you really want and who you really are. And in realizing who you really are, the issues that you have that may be preventing you from going to the next level. Like for me, for example, I hated reading. Like I hated reading. And I'm like, I want to be a doctor.
yeah, you need
I
to be
have to
able to
like to
read,
read.
right?
And so, right. And so it was something that I had to work on, diligently and just to try to develop a love for reading. It was something that I embedded into my daughter because I knew that that was something that I didn't have. And I think a lot of times when people struggle with feeling like they don't have resilience, it's because we believe that we are who we are. But the reality is that we can be whoever we want to be. Like there is a Les Brown, I love him a lot, and he always says like a tree can only be a tree, an animal can only be an animal, but human beings, we have endless potential. And being able to do whatever it is you set out to do. And that starts with one, setting the goals and have and this self-discipline that we don't necessarily talk about a lot. I think a lot of times we on, being successful, but we don't really talk about the self-love, the self-discipline,
Mm,
and the
mm,
goal setting that's
mm.
necessary to get to that point.
Absolutely, absolutely. Self-love, absolutely. As I always say, you're the person with whom you spend most of your time. So the way you talk to yourself, the way you perceive yourself, the way you tell yourself what you can and can't do, this is definitely going to affect you. So you should talk to yourself the way you would talk to your best friend. Would you say that to your best friend? And I
Right.
say that to my best friends. I'm like, would you say that type of thing to me? And they will go, my girls, they will go
Right.
like, no, never, because I don't think that about yourself. So what do you think that about yourself? Because I
Right.
know for a fact that it's not true. So the way you talk to yourself and the way you
Yes.
tell yourself what you're capable of, and only you can tell you what you are capable of. It's not other people, because other people, they will come from a point from their own problems and from their own shit. So let them deal with that, and you deal with your own,
Exactly.
and it's already a lot, honey. It's already a lot dealing with your own shit.
Yes.
So start with you. It starts with you. In the middle is you. In the end is you. It's all about you, not like in a self-centered way, but in a way that is it is what it is, and you're Reality is your
Right.
own, and you can only see it from your own eyes. No one else can do it for you, and no one else can tell you who you are. And even you don't really know who you are. So let's start with
Exactly.
that.
Exactly. And I think it is very important to know that a lot of times people are not coming from a bad place. They just want you to have the easiest path necessary to live what people think is a happy or stress-free life. But the reality of it is that we're all going to go through ups and downs, and life is going to be hard no matter what, in my opinion, because my grandmother was a cook. She was a farmer. My great grandmother was a cook and a farmer, so she worked really really hard to be those things. So I was always thought like, well, okay, if I don't work hard to be a doctor, I still would have to work hard to be something else. It doesn't mean that you won't have to work hard, but a lot of times, the ideal is that if a goal seems very difficult or unattainable, sometimes your loved ones just don't want you to stress and don't want you to go
Hmm.
through, what they think is very difficult or impossible. So it's not that people are always coming from a bad place. It's just that it doesn't matter what place they're coming from. You have to focus on you. And even for me in this journey, I have had to isolate myself from a lot of people because I didn't have time for their energy, no matter what their intentions were. But I think that it's very healing and positive to not always think that everyone has like the worst or negative intentions, but some people do and some people don't. But the focus is just it. You do have to have those times where you are selfish and you think like, okay, what do I have to do to reach this goal? Who do I need to be around? What type of people do I need to be around? How do I need to around my? Can you hear me? Um,
Yes, I can hear you. So what type
and,
of
and
people do
also
I
like
have
protecting
to
all
have
of
around me?
sorry
And then it's
protecting
okay.
and also protecting all of our gates. When I get into those moods where I feel like I'm coming down, I really have to be careful about everything that I listen to. That's when I really start listening to
Mm.
lots of sermons, motivational speech, making sure that I am just protecting all of my gates, what I see, what I hear. If you feel like you're already in a stressful situation, there's no need to go watch a movie that has a lot of violence or listen to music that's not uplifting. So you have to be very, very careful with who you are and who are becoming, and that I think helps you to be resilient and reach those end goals.
So in order to be resilient, first is watch how you talk to yourself. Take the time to check in with yourself. Also, whatever you want to be and do in life, you can. Only you can. No one else is going to do it for you. And you shouldn't let anyone else get in your way because it is your own life and you have to live it for yourself. Another way to also be resilient, as you said, is really when you feel
Yes.
like you are being a little bit less motivated or you are feeling a little bit more depressed in your life. It's really watch all type of what are you listening to, what are you watching, who are you listening to, because as you said, for mental fitness, when it comes to your what you eat and your meditation and your sports or movement habits, also this all of that is also in a way your diet, the people you speak with, what you want to listen to, the movies you want to watch, the books you want to read, all of that affects you. It affects your
Yes.
mental health. It affects your physical health in the end. So you have to be really mindful about
Yes.
everything you do, everything you eat. And I think
Right.
it might be like a little bit like stressful, or it might be a little bit like it like seems like a big task. So start small. Start small, start with one thing, and then you will see that at some point it will just become your life. And then at some point it's just your lifestyle and it's just part of who you are. You are someone who, let's be honest,
Who
gives a
are?
shit
Yeah.
about what you want in life. And you are very intentional
Yeah.
about that, and you are into intentional living. And I do believe that that helps a lot with depression. I know that it really helped me because I am prone to depression. And since I've been, and I became more intentional in my own living when I developed this autoimmune disease. And so yes, I definitely watch the way I talk to myself. Well, that I always watch, but even more now. My food diet, but also what I read, what I watch, and even sometimes people, they will gift me books because me, I love reading, and I will look at the book, I will read like the first 20 pages, and if I think that this is not going to be helpful in my life, I'm like, I like this book. It seems like a very interesting book, but it's not for me. I'm not going to read about that. I'm
Right.
not going to read
Exactly.
about whatever war or
Exactly.
slums or whatever you think is interesting to know about in South Africa, because first off, I already know about that, so I don't need someone to like romanticize it or make a book out of it. I don't need that. So yeah, definitely
Right.
people,
Yeah,
when it comes to
exactly.
resilience, it starts with you. What do you allow into your life, and
Yes.
how do you protect your own energy and the way you've been working
Protecting
on yourself?
yourself.
Good, good,
Exactly.
good, good.
Protecting yourself and knowing your boundaries. Protecting yourself and knowing your boundaries and realizing that it's
Exactly.
okay. It's
Exactly,
okay
exactly.
to have boundaries. Yes.
So yeah, protecting yourself, your boundaries, it's okay. I know that you have 4 kids at home, right? So you don't have that much time, but it's
Yes.
okay. I'm just going through the questions that we have and just to see if we've been through everything. Yes. So one last questions to circle back to the topic of mental health. As a psychiatrist, when all of this is, when it's all said and done, what are you going to be looking out for as a psychiatrist? What do you think the type of decompensation people might be going through, and what do we have to be mindful about when it comes to our own behavior and the behavior of our loved
Mm-hmm.
ones? So what
Yeah.
is the
So
fallout
I
of
think for
all of
me,
this?
yeah, for me, the thing that I'm most concerned about is addiction. That's my number one concern right now. I think anyone in this pandemic that already had an addiction really probably struggling really hard with that right now. Because a lot of the things that we want to do to kind of evade their addiction, not going to mindful places and things like that, they cannot. And so I'm really concerned about those with that have addiction. I'm concerned about people developing addictions during this
Mm,
time to try to cope. You know, a lot of people, the first thing that they deal with to cope is alcohol and marijuana and cigarettes. And so I'm concerned about those addictions. I'm definitely concerned about depression and anxiety that are surely coming along with this pandemic. And I'm also concerned about what we call those first break episodes. And so whenever has their first full break of mania, which is bipolar disorder, or of schizophrenia, a lot of times they say that it happens in a very stressful time or a very stressful
mm,
situation. And this is a very stressful time. And so I'm concerned about people not getting the access that they need, those people that may be having a first break mania, first break psychosis during this time. Families not necessarily recognizing the signs of mania, which is distractibility, irritability, grandiosity, like people thinking that they may be a CEO or have a lot of the kind of things that we think about, or they say they're going to start all these businesses. Um, just flight of ideas, so like a lot of random ideas and speaking fast, thinking fast. These are things that we think about with mania. And then with schizophrenia, first break, it's just a lot. Sometimes people can have what we call negative symptoms where they're very flat and just not themselves, like becoming kind of blunted. Those positive symptoms of hearing voices and seeing vision, being very confused and being very paranoid. And so I'm concerned that families may not necessarily know what's going on, especially if it is combined with drug use.
mm.
People will just automatically think like maybe it's just drugs or something. I'm really concerned about those first break episodes that are happening right now during the pandemic, and also definitely looking out for signs of depression and anxiety, and wanting people to know that regardless to how that depression came about, if it was because of coronavirus, you still can seek treatment. You still need to seek treatment, because it doesn't matter what the cause was. We still have the responsibility to kind of heal ourselves. And that is a very, can be very frustrating, because we kind of think when this thing is over, everything's going to go back to normal. But we are going to have to fight for ourselves. And I'm really concerned that people will think that just because the virus caused it, when everything kind of normalizes, that, these mood symptoms will go away. And, maybe they will, but in some instances they won't. And it is okay. And I advise people to definitely seek treatment for that.
So you heard it, people. It's not because you're feeling depressed or you have a lot of anxiety right now that is going to necessarily stop after the coronavirus. And for all we know, it can last for another 2 years or 3 years. So please, 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 either you or someone you know, you have to seek treatment. And you can also help your loved one by holding space and being a safe person who they can talk to. Thank you, Dr. Carly. This was so interesting, and I would love to do this like for hours, but you are a very busy woman. You're a very busy doctor. So
Thank you. Thank you all for joining. Thank you all for listening. Thank you so much. Thank you so much for inviting me. And I hope you feel
you are
better.
so welcome. Yeah, me too. Me too. After this, I'm just going to have some more herbal tea, and then I'm going to sleep for 12 hours after I do my night meditation, because that's my self-care, love-care, mental health
Yes.
care routine. Meditation in the morning, meditation before I go to bed.
Yes.
I love it.
I love the
Thank you so
meditation.
much.
Yes,
Yeah,
for sure.
so good.
I just wanted to say meditation, sunlight, and sleep are very, very important. So make sure you do
Oh,
all those
great.
things.
And hydration and hydration.
Yes, and hydration
Thank
for
you
sure.
so much for all your great
No
tips.
problem.
If some of you missed all of that or some of that, there's the replay for 24 hours. Then I will also upload the video to the YouTube channel, and you can see it there. Dr. Carly, thank you so much.
All right,
Thank you
awesome.
so much to the audience for joining, for being there with us. And a particular shout out to Dr. Joe, PhD, and Dr. Diona. Your girls rock. I love looking at your comments. And thank you so much. Have a great afternoon with your girls. And really, thank you for
Thank
all
you.
that you are doing in this time of pandemic as a healthcare professional. Thank you for your service. And again, congrats for your diploma. And as you said, because I love to always finish with something the guest said that I find very interesting. And I love how you said that untreated mental health affects every aspect of one's life. So people,
Yes.
be mindful about your own mental health and the one of your loved ones. Take care.
Thank you. Bye.
Thank you. Bye.